In 2020, as the world grappled with a global health crisis, a shadow fell over Britain's elderly and vulnerable. It was a harrowing story of betrayal and loss. Allegations have emerged that those in power, the bourgeoisie, the pharmaceutical industrial complex, and their lackeys in Parliament, waged a calculated assault on the weakest members of society. Care homes and hospitals, once places of refuge and healing, were reported to have become sites of unimaginable horror, where families were denied access to their loved ones and controversial medical protocols led to countless deaths. The Scottish COVID inquiry opened some people's eyes to the scale of these events, exposing what some believe to be a deliberate effort by a complicit media to obscure the truth. Reports of withheld food and water, the use of powerful sedatives like midazolam and morphine, and the blanket imposition of do not resuscitate orders paint a chilling picture.
Because at that time, I said, just give my mom palliative care medicines. I'm getting used charged with my defense house to my mom. But we won't know that. We won't know how to do anything.
These murders didn't take place in isolation, but in context of a giant population pyramid with an ageing population. Rising pension liabilities, economic pressures, and a colossal national debt with a rotten economic mode of production incapable of solving these issues without a mass culling or a mass rearmament for war. One question remains. If the government claimed to prioritise protecting the elderly in 2020, why and how were protocols like NG163 and NG191, alleged to have hastened thousands of deaths, implemented? And now, with the passing of the assisted dying bill, has the narrative shifted from safeguarding our elderly and disabled loved ones to deeming them a burden? Britain in 2025 shows the decadence and wanton disregard for human life characteristic of a neo-fascist character. This is Unseen, the truth behind the death protocols. In this documentary, investigative journalist Jacqui Deevoy and me, filmmaker Richie Brown, follow the stories of 8 families devastated by these state-sanctioned protocols where politicians, doctors and nurses were empowered to decide who should live and who should die. Despite the Scottish COVID inquiry receiving scant attention, even from alternative media, the testimonies we heard compelled us to shine a light on a very dark chapter in Britain's history, a chapter marked by moral decay and a chilling disregard for human life. Join us as we uncover the truth behind these protocols and confront the uncomfortable questions they raise about our society.
The shielding of vulnerable people and the elderly, who are the most affected by this virus, that is in our plan.
I feel my mother was murdered, basically, and I think that's why it's very difficult for me to get over it.
And she got morphine and midazolam. It's the first, even asking the question, first time I'd known about the use of midazolam. And that's when I realised I'd actually let it happen on my watch. And I'd gone in to stop it and still never stopped it.
I think the midazolam and morphine was a massive factor because I feel like even with the ventilator.
So do you know if she'd been put on an end-of-life pathway?
Yes, yeah, they put her on that. They said she was 76, she's coming to the end of her life. And my mum was nothing like it. She had nothing wrong with her at all. She was as fit as me, and the only thing she was doing was grieving my dad.
The COVID inquiry has been told that Matt Hancock wanted the ultimate say on who should live and who should die.
The best estimate by leading vaccine producers is that it could take a year or more to develop, test, and manufacture a vaccine for the Cladex virus.
Started in 1985, going totally freelance. Working for mainly teenage and women's magazines back at the time, which was really fun and enjoyable. But over the last 5 years, I've kind of lost a lot of faith in the mainstream media, especially the newspapers, and have been writing more and more for alternative news outlets and papers and websites. So yeah, it's just especially, I mean, newspapers have got a reputation for kind of sensationalizing things and making things up anyway, but over the last 5 years, it's been off the scale. So And I started sending them stuff back in 2020. The very first thing I found out was back in March 2020, when the coronavirus, as it was called then, was downgraded to not a highly infectious disease. So I found that out in March 2020, and I had an article published on March the 24th, 2020, pretty much saying, that this is what's happened. So I sent all this out to all the mainstream papers at the time saying, look, you can put this on the front page of the paper, tell everyone it's nothing to worry about. I knew it wasn't anyway, but I've watched Event 201, but and I kind of know how they all work.
2016, the World Economic Forum, together with the World Food Program, presented a global supply chain management approach for this exact scenario. And what might be helpful, given that everybody suffers from a short-term memory deficit, is to have an emergency briefing on those resources that are global public goods that are there to facilitate supply chain management and where those can be deployed, but also CEPI, which was established 3 years ago to accelerate vaccines exactly in development in these settings where a coronavirus is in fact one of its indications and first areas of focus. That may not be common knowledge. Likewise, on the financing, there is global financing.
But the newspaper editors, I don't think actually did know at that stage, because they're kind of in this little bubble, where they believe everything they're told a lot of the time, or they have to pretend that they do. And I sent that to a lot of papers, and they didn't want it. And I was saying, well, why don't you want to publish it? You can reassure the public, because they're all in a state of panic at the moment. They didn't want to reassure the public because, as we know now, and as a lot of us knew back then, they wanted to scare the pants off the public, and they were going to do that in a number of ways, using the mainstream media as their main conduit to do that. So I kind of just got a bit fed up about that. Then I started looking into the whole euthanasia thing that was going on in hospitals and care homes after a man came to me. It must have been around autumn time 2020. Yeah, it was, because my dad was in a care home at that point, and I remember standing in my dad's empty house taking this call. This guy rang and said that he'd seen me talking on David Icke's podcast. David interviewed me back on December the 9th, 2020. No, so it must have been shortly after that, so it's coming into winter 2020, when this guy was telling me that a relative of his had been murdered in an NHS facility. So I hadn't heard anything like that up until that point, but I wasn't surprised, because I've heard so many, shocking, outrageous, unbelievable things over the last few years that I listened to his story. We agreed to meet up. He had a huge pile of incontrovertible evidence, including drug charts, medical records, you name it. He had all the proof. So over the next couple of months, we put together a pitch, really, to give to the mainstream media. So initially I pitched this story about what was going on to 28 papers, I think, initially. I've now pitched it to more than 100 editors and staff writers over the years, but back then we started with 28, and none of them were interested. In fact, I didn't get a reply from most of them. I think one person said they were on maternity leave and would get back to me, and another person said they were on holiday, and someone else said they'd pass it on to someone else. But that was it. There was it was like a shockingly low response rate. So I thought, what am I going to do with this story? And by then I'd been speaking out about it, and a lot of people were coming to me with their stories, similar stories to this man's story, that their loved ones had been euthanized, involuntarily euthanized, which is murdered as far as I'm concerned, carries the same jail sentence. If you involuntarily euthanize someone, that means you're killing them without their permission. Even if you had their permission, it's still a crime. You'd still be committing murder. So so I put together this WhatsApp group of people with their stories, and that I thought that these stories need to get out. And then Jamie Ike, David's son, who runs Iconic Media, he contacted me because he knew what I was doing and said, why don't we make it into a documentary? So we started making that, and that was released in December 2021. That was called A Good Death. And that was an investigation into involuntary euthanasia in UK NHS facilities, hospices, hospitals, care homes. And so we started that, and that was released in December 2021. It was also to provide a platform for these people in my group. Every day more people were joining. A lot of people don't want to join a WhatsApp support group, but since then I've spoken to hundreds and hundreds of people with almost identical stories in some cases, each one more horrific than the last.
It's quite a traumatic thing, isn't it? Because they're essentially gaslit into believing something that they saw with their own eyes didn't happen.
Yeah, absolutely. And that's probably the worst thing. And a lot of these people, well, I'd say 99% of the people that I've spoken to feel a terrible guilt as well, because they think, why didn't I do this? Why didn't I do that? And knowing what they know now, looking back, I could have done this, and it's a terrible, terrible thing. Also, when you've had a loved one taken away from you in such a horrendous way, you can't grieve properly, So if you've had a loved one who's been murdered, you can never grieve, but instead you suffer terribly, sleepless nights, anxiety, depression. It's absolutely awful. There's people in my group now. There's 157 people in the group today. And that is just the tip of the iceberg. I've spoken to 10 times as many, and at least. And every day, if I put a post on Twitter, on X, about anything to do with that, if you look at the thread afterwards, there's hundreds and hundreds of people saying that happened to my mum, that happened to my brother, In fact, I put up one of the most recent members of the group. She joined just after Christmas. She's a journalist friend of mine, and she contacted me saying her mum was in hospital and they'd put her on an end-of-life pathway. She'd had a stroke and she was 85. And because, it's a very ageist system, there's a frailty score or something called the Glasgow Coma Scale as well. They kind of measure people. If you're 85 years old, you get extra points for that. You could be the fittest, healthiest 85-year-old person in the world, but you still get your 5 points for being 85. You get extra points for comorbidities, such as diabetes or kidney problems or whatever. And then if you score a certain amount, then you're put automatically on this pathway. So my friend said, what do I do? So the story that she told me about her mother completely fitted the profile, and I said, okay, if you don't get her out of there or get her off that pathway, get those drugs taken away, she will be dead in a few days. Once a syringe driver is put onto somebody in that situation, and that's a pump that intermittently administers medications, once that's been put in place, it's an average of 29 hours before the person passes away. Some people go quicker, sometimes it takes a lot longer, depends on the individual. In this case, I thought it's going to be maximum of 3 days. She went into the hospital, said she wanted her mum taken off it. They talked her out of it. They talked her father out of it as well, who was very, upset at the time and stressed. They take advantage of this situation where the people just don't know what to do, So anyway, her mother died within a couple of days. And then it got worse after that, if you can imagine, because she knew it was going to happen, but they couldn't stop it in time. That's the thing, because time is often of the essence in those situations. And she, when she got the phone call saying her mum had died, she went to the hospital, went into the room where her mother was. Her mother had just been left dead, with her eyes open, with her mouth open, the room in disarray, with the syringe driver still attached, bright lights. She was very shocked to see her mum like this. And she's quite a tough.
The organised democide of 2020 was not an aberration, but a logical extension of the Liverpool Care Pathway, which advocated death pathways. After a string of abuses and outrages such as this, the Liverpool Care Pathway was officially abolished. All I remember is they weren't feeding me. Up above my bed they put nil by my mouth and I was begging for food, she recalled. However, even the prostitute BBC was forced to admit that it had continued unofficially.
Just under half of us die in a hospital. Good end-of-life or palliative care is designed to make that last experience as comfortable and dignified as possible. The Liverpool Care Pathway, or LCP, introduced in the 90s in England, Scotland and Northern Ireland, was meant to make that easier. Among other things, it introduced a checklist. Think of it as a prompt for hospital staff to help them work out if drugs, fluids and invasive tests can be stopped. Those kinds of treatments can be painful or unhelpful in the last stages of life. The pathway often worked well, but when it went wrong, it was extremely controversial. There were reports of treatments being removed too quickly. Some families said their loved ones had been left without food or water. The most damaging complaint was around communication. Some patients were being put on the LCP without anyone giving permission. Some families only found out about it after a loved one had passed away. After all the controversy, in 2013 the government scrapped the Liverpool Care Pathway in England. It's also being phased out in Scotland and Northern Ireland. It should be replaced by individual end-of-life plans, tailored to the patient and discussed with their relatives. But the debate isn't over. Critics in the medical profession say some hospitals have simply rebranded the LCP, giving it a different name, but continuing many of the same practices.
Aye, that's what I says to him. I says my mum's no dying of COVID. My mum's dying of starvation and dehydration. And you just had to look at my mum, see that her eyes were sunk right into the back of her head.
Dr. Vernon Coleman has been calling out the corruption in our medical institutions for decades, once the darling of the mainstream press, and heaped with lots of praise. He found himself censored and silenced when he began speaking out at the fraud of COVID-19. Dr. Coleman was quick to point out the COVID fraud in many of his books, here of which are a few: Endgame, The Hidden Agenda 21, COVID-19, the greatest hoax in history, COVID-19, the fraud continues, anyone who tells you vaccines are safe and effective are lying, and his recent book, The End of Medicine. I asked him to give his views on the Liverpool Care Pathway.
The aim of the depopulation plan is to gain control of the world, set up a world government and lead us via the horrors of net zero into the wilderness of the Great Reset. A subsidiary aim is to save money by dramatically cutting the amount of money spent on pensions, benefits, welfare and medical care. We've entered our own killing fields, and this is truly the slaughter of the innocent. It began with the Liverpool Care Pathway, one of the most shameful and inhumane programmes ever introduced in medicine. It was simple enough. Patients whom doctors or nurses thought were too old were literally starved of food and drink. They were denied medicines they needed too. Doctors and nurses who were employed to save patients were doing the opposite. It was legalised murder. The Liverpool Care Pathway was condemned, but it still continues. The problem with it, as far as the establishment was concerned, was that it could only be applied to the elderly and the very ill.
First got involved in campaigning about end-of-life care protocols, what was called the Liverpool Care Pathway at the time, 2012, when my father was admitted into our local hospital, Liverpool NHS Trust, with abdomen pains. He got all relevant tests. It should have only been an overnight stay. He got diagnosed with constipation. There was nothing sinister going on, but the overnight stay turned into 8 months, 7 of them in critical care. So, long story short, Dad was basically put on the Liverpool Care Pathway. Even though the hospital denied it, especially critical care, they didn't use the Liverpool Care Pathway. That's what we got told. But the amount of times that we went in and Dad's fluids turned off or low, and he appeared to be severely dehydrated. Different things going on. He ended up ventilated because we told he caught hospital-acquired pneumonia and sepsis very early on after being admitted with constipation. They were all hospital-acquired. So this is what led him into critical care. He was only there for 3 days, And we got a phone call in the middle of the night, get the family together, he's dying, even though we were there a few hours earlier, and he was fine. So we all rushed down. We only live around the corner from the hospital, and we rushed down, and the doctors were actually all around him. They put him in a room of his own, whereas hours earlier he was out on the bay of critical care. So there was no phone call to say, you know, they were doing all that, or no sort of like suggestion on the visits that they were going to be doing that. Dad was out cold, sedated, and they were actually in the process of putting the life support pipe down his throat. It's like they wanted us there to see what was going on. Mum got called into a meeting with the consultant on charge that night to say Dad went into septic shock. He caused another hospital-acquired sepsis and pneumonia. He went into septic shock, and in their opinions, Dad would die within 48 hours. But they are giving him life support, and there was all bags of whatever keeping him alive, 13 bags, I remember. By law, they've got to do that. We got told, but for dignity, and he's going to die anyway. Mum got told if she signed to consent to take him off treatments and they would up the morphine and he'd pass away more dignified, because he will die anyway. So Mum wouldn't agree to it because they wouldn't tell her what happened in the short time, 3 weeks of driving himself in with constipation. So it was because they wouldn't answer questions, Mum wouldn't agree. So long story short, Dad didn't die that night or the 48 hours. He actually lived 8 months after that. So in that time, it was just a vicious circle. Dad, we got told from right at the beginning he would never get out of critical care, even though he was sort of doing physiotherapy out of bed, and at one point he was on a point of rehabilitation and with the possibility of going home for him to go on a rehabilitation ward, and so he was progressing. But this dehydration used to, there was always issues with dehydration and these hospital-acquired infections which would deteriorate his body. So as time went on, we were getting called into best interest meetings. Mum was next to kin, so we all had our say, but Mum was next to kin, and they just wanted to basically withdraw treatments. So Mum was like, well, you explain to me what's happened to him in the care of your hospital. He's got a diagnosis of constipation. You know what? Oh, they wouldn't. So because they wouldn't, my mum wouldn't agree. So this went on and on and on for months. So the very last best interest meeting, Mum got told, and it was all this: if you don't agree with us, right in her face, by a top consultant, we're going to have to take you to court, Mrs. James, because you're the only family that never agreed to what we want to do. And my mum went, what is it you want to do? So he just said, what's in the best interest for the patient? My mum went, well, you explain to me what's happened to my husband in your hospital. What's this big? How did he become critically ill after 3 weeks of driving himself in with constipation? And that was it. Well, we're going to have to take you to court. This is your last chance to agree with us. So my mum just went, take me to court. Take me to court then. And they weren't expecting that. My mum just went, if a judge agrees with you, I'm going to have to go along with the judge, aren't I? But we'll see. So little did they know, we were taking notes. Me and my mum had diaries. We were taking photographs of Dad, videos of Dad on good days and bad days, every day, right throughout the months. So this court case come about. They rushed it right through before Mum and I could get legal representation. So we had to represent ourselves. This is down in the High Court in London. It started off first in Preston, but it ended up down in London. And the judge listened to me and Mum. It was better really in some respects, because we were able to say more without a lawyer sort of saying, well, you can't say this, can't say that. So this judge was sided from the family from the very word, the very go. And he just said there was 5 consultants from the hospital there with all the legal, the barrister from London and everything, and just me and my mum in the front. So the judge ordered the doctors to go back up to Liverpool to tend to their patients. He said, why has it took 5 doctors to come down for this? You should all be in the hospital tending to your patients. He got them out of the courtroom there and then. And he made it quite clear to the hospital he would not be given the piece of paper they want to withdraw treatments. That was it, basically. So, they tried it, they tried to do this, that and the other. I can't remember the legal things they tried to do, but the judge wasn't having any. In the end, the judge just said, any further court hearings we want up in Liverpool. This family is up and down to London all the time. because, you know, and I'm telling you now, I will not agree to what you want. So, you know, you're wasting this family's time, expense as well. They should be in the hospital with their loved one, but you're dragging them into court, losing, you know, valuable time. So it come back to Liverpool Civil Court. We got a Judge Jackson who was human rights judge, and by this time we were represented by a very good law firm, Liverpool Brody Jackson and Cantor. So we were represented. So it was in and out of the civil courts for a while. So in the end, the judge wasn't persuaded neither of what the hospital wanted to do, so it went to trial. So long story short, the family had more evidence that treatment should continue. They still denied, the hospital still denied Dad was on the Liverpool Care Pathway, but what they said was he was on end-of-life treatments, even though he wasn't end-of-life. So, to me, the Liverpool Care Pathway, end-of-life care, palliative care, through our experience with Mum, recent experience in the same hospital, it's all the same thing. All the same thing, it's just worded different. The same drugs come into it. Palliative care and end-of-life care is not black and white, it's a very grey area. End-of-life drugs, even though patients can live years on palliative care, end-of-life drugs can easily be brought into it to shorten their lives. It can easily be done, which we've witnessed recently with a lot of patients in the same hospital. And in my eyes, it's gone worse since 2012. The Liverpool Care Pathway was supposedly stopped in 2014, soon after the family's Supreme Court case. The family won the trial case in the High Court, but Dad sadly passed away in the December 2012. It was New Year's Eve 2012. It was because the hospital appealed the trial decision, because Dad took a deterioration of hospital-acquired pneumonia, so they had it rushed back into the courts, and they got that piece of paper, what they wanted, in the appeal court. So, of course, our barrister was fuming. It was the last day of the court open before Christmas, so that was it. And Dad passed away New Year's Eve, so 2012. So Mum got a phone call soon after in the January to say that she could, even though Dad had passed away, she could take this into the Supreme Court to get the law sorted out, because there was two judgments there. One from the High Court trial case, which the family won, and another judgment was passed through the appeal court, which the hospital had overturned the trial. So it had to go to the Supreme Court to get the law sorted, if you like, which case stood. So Mum appealed against the hospital. She lost the appeal, but what happened was the appeal court judgment, it was more or less ripped up, and it went back to the trial case, what the family won. So even though, it's like, to me, they tried to keep both sides happy. They tried to keep the hospital happy by Mum losing the appeal, and tried to keep the family happy by it going back to the High Court judgment, and the hospital's appeal court was ripped up, basically. So that still stands today. It set a precedence in the Supreme Court to help other families going through similar things with end-of-life care protocols for patients in critical care who doctors say the patients lack capacity. Now, in my eyes, you don't have to be in critical care to lack capacity. You can be on an ordinary hospital ward. But if it happens for families to be the patient's voice, what the patient's wishes are, and the family's wishes. Now, that still stands today. It's still being used as case law, Inchie versus James, and it's been used in quite a lot of cases that I know of. So that's that. So, excellent. Yeah. So that was the Supreme Court case. Yeah. The Mum set a precedence. It was a high-profile landmark case. It was all in the mainstream media. The judge brought the media in. The hospital didn't want it, but Judge Jackson brought the media in. In his words, he didn't want this case to be brushed under the carpet. He's one of these judges where he's pushing for cameras in the courts for cases, and he wanted this in the media. It wasn't the family, it was him. So that's how it all got in the mainstream media, and it did end up in the Supreme Court as a landmark case, high-profile case, which, as I say, still stands today.
The Liverpool Care Pathway at that point.
We had.
That's the one, because years later I found out my gran was murdered with the Liverpool Care Pathway back in 2011, before it was made illegal. Now, my auntie was asked to put my gran, who got pneumonia, she was 98 at the time, on the Liverpool Care Pathway. And she was like, oh, care, she's going to be getting special care and all this. She signed it. I was with her when she signed it. And then it's like, they withdrew food and water. I'm like, what are you doing? They're like, oh no, we don't give them food and water, we withdraw all fluids and medication. So she'll just slip away. But I don't know if midazolam existed back then. It probably did. I'd never heard of it.
It's been around for a while, actually. That.
My auntie actually thought that, oh, it's a care pathway.
She's getting extra care, yeah.
But what you don't realise is that care pathway is a pathway to death. So, yeah, and it's not a natural death.
NG163 is identical, pretty much.
It is identical. I mean, they use the emergency situation as an excuse to bring in these protocols. But yeah, it's just part of a depopulation agenda.
So we use the midazolam and morphine on death row in America to put the patients, the convicts to death. So, you know.
But it's been outlawed there because it was inhumane and classed as torture.
Yeah.
Now, we did actually bring up the Torture Act with them and the inhumane treatment, but obviously, again, you're talking to a corrupt system.
I'm Deborah Sardi, partner of Chris Barnatsos for 23 years. We have twin boys together, and they were 12 years old when this all happened. Okay, so Chris had MS, and he had relapsing remitting MS, had to be moved to a ground floor adapted flat, so everything was accessible for him. The morning of the 10th of August 2021, Chris called me in the morning and with a pain. I went to his house later on. I was there all the time, I must say, because I was his PA carer. The boys were half living there as well, so he was supported by us all the time. Get there, he's got a terrible distension on his abdomen, which is labouring his breathing. I had to get him to hospital, which is what neither of us wanted. He arrived at the hospital with my nephew, young Chris, who I trained as a carer by 8 p.m. He was taken to a hospital that we didn't want him to go to, maybe not say the name yet. And the second the paramedics left, everything went downhill. That was from 8:30 p.m. Chris was on oxygen because of the laboured breathing from this terrible pain. They put him on a drip when he was drinking very well, which we couldn't understand why. They forced him to be horizontal, which we objected to. Young Chris was searching for hospital staff who were around not doing very much because it wasn't very busy. They would not provide any pillows, they would not raise the bed. A doctor wouldn't come and examine him. No, there was no examination that took place. The nurses were coming in and abusing him, being very aggressive, slamming doors, bins, cupboards, because of his MS, moving the pulsometer from his ear to his finger, which didn't work, having a go at him because he had a trigger finger from the MS, saying that they wouldn't do his obs as they should, and giving him a really hard time. Chris was conscious, he was talking to young Chris, he was very mindful of Chris not being offered anything to eat or drink, was telling him to go and get some refreshments, which young Chris of course wouldn't leave his side. I was on the phone to them both, and they were just being ignored. Young Chris eventually found a doctor at 2:30 a.m. This doctor, who we'd be able to describe, came at 5 to 3, 2-minute non-examination, virtually laughed at Chris's pain and walked off. Before he walked off, young Chris and Chris asked him for pillows, and he said literally, sorry, no pillows, like that. and off he went. The nurses were coming in, the odd nice one, the rest were just really not interested and nasty. At 5 a.m. he was told that he would be going to ICU, to a ward. Young Chris was told to leave, which he didn't want to leave, said, insisting on me coming up and taking over, and they said not to worry, that Debbie will be able to come as soon as they've got him settled in the ward. I received a phone call about 7:30 in the morning from nurse in charge Gina, who was explaining what ward he was in, and a doctor would phone. Literally minutes after, a junior Dr. David phoned me, and he asked me who I was, and I said, well, you know who I am, you phoned me. And he said, no, who exactly are you? So I said, I'm Chris's partner of 23 years, and he starts going into a frenzy of, oh my God, you have to tell everyone you're the wife, please don't tell anyone you're the partner, just stress that you're the wife, tell everybody in this hospital that you are the wife. And it was very bizarre, and said not to come till after 9 o'clock. So make my way there, get there before 10 o'clock. By the time I find the ward and everything, and I get taken into a seminar room by a sister Florence. I can see her name tag, and she's very strange, asking me for refreshments and anything at all. Would I like something? I said this is highly unusual, and she's really stressing it. So to shut her up, I eventually have a coffee. I think this is some kind of softening up mechanism going on. And in comes what I call a split team. Across the tables is Junior Dr. David and Nurse Gina to my right. Senior consultant introduces himself as Abdul, and the rest Florence and some male nurses and a female nurse. And I ask them what's wrong with Chris, and they tell me that they have no idea what's wrong. I said, what do you mean? He's been here 14 and a half hours. They said, we've got no idea what's wrong, but we've decided to put him into palliative care. I said, what are you talking about? The man's not dying. He said, no. And he starts talking about the government. I said, what do you mean? He said, well, I've decided to put Chris into palliative care because he's got MS, he's costing the government and the NHS far too much money. And I nearly hit the roof, calm, and I start talking about the government. I said, I know about the government changing the goalpost. Chris is not dying. You have to investigate what's going on. I talk about the stem cell treatment that he was going to have on the NHS, and the government changed the goalpost. I said he was examined by a neurologist less than 2 weeks prior to this. He's going into neuro rehab in preparation for the stem cell treatment, which we're paying for privately. And he starts laughing at me, even though he's got a mask on. And he starts saying that it's palliative care. And then he starts doing a CPR action. And I said, what are you doing that for? He said, it wouldn't be very nice, would it, for anybody? Didn't answer him. Then he does it a second time and says, wouldn't be very nice, and he's grimacing now. I said, well, there's nothing wrong with Chris's heart. He's as strong as an ox. He's constitutionally strong. He's just got MS. And then he starts very aggressively grimacing, sound effects galore, saying this would not be very nice, would it? I said, oh yes it would if a patient requires it, but Chris doesn't require it. He's got a very strong heart. He has no heart condition. So why are you doing it? And he nods at me and says it wouldn't be very nice for any patient, would it?
It was the 2nd of September 2021. I received a phone call from a police officer who said that our dad had collapsed, had been found by a member of the public and had collapsed in a car park. And he had been rushed into hospital. His oxygen levels were low, and therefore he was taken to A&E, and they were doing his obs. And at that point, I said, oh, is Dad there with you? Can I speak to him? He said, yeah, sure. So he passed me over the phone, and I said, oh, Dad, what happened? And he said, oh, I just felt really, really weak. I needed to just get back to the car, have a drink, and just sit down. And then my legs just went. And then he passed the phone back to the officer, and the officer said, oh, his obs are sort of returned to normal, so you're going to need to collect him. So I was like, yep, sure, that's absolutely fine. So I said to my dad, I'll come and get you and come back and stay with me or Kel. Obviously rang Kel and told her what happened, and then shortly after received another call from a doctor who said, we're keeping your dad in overnight, we think he's got COVID. And it just kind of spiralled from there, really, didn't it?
Yeah, when he rang, he actually said your dad's got COVID and he's going to ICU, and he's not in a very good position. But I think it was about 15-20 minutes prior to that you spoke to the hospital, and they said, you can come and pick Dad up. So it was a very short window of time from he's fine to, oh, he's got COVID and he's got to go to the ICU ward.
My name's Lorraine, and I want to talk about my mother, Elsie, she was euthanised, actually. I was going to say she died, because that's what we're encouraged to say, but actually I feel she was, sorry. Sometimes I can talk about this, and sometimes it's incredibly difficult. I don't really know why, but I feel my mother was murdered, basically, and I think that's why it's very difficult for me to get over it, because it's not like a normal bereavement. And also it's difficult to get over it because when you try to do something about it, when you approach the hospital and the ombudsman and your MP, as I have, and the GMC, they're not interested. They're not interested to look into it. They're not interested to look into how the doctor was practicing and why Mum was put on the end of life. So what happened with my mother, she complained to me that she was feeling unwell, and the ambulance person came and said he was going to take her to the hospital. And strangely, my mother actually said to the ambulance, the paramedic and myself, I don't want to go to hospital, because if I do, I won't come out. I have no idea why she said that, because we hadn't heard of anyone at that time, going into hospital and then being put on the end of life, but that's what she said. And I suppose part of me sort of regrets trying to persuading her to go into the hospital. When she went into the hospital, she was diagnosed as, well, initially they said she was fine and they were going to send her back, and then they found that she had pneumonia, and they kept her in hospital, and they put her in a side ward of accident and emergency. And I must say that in that ward, they did treat her, and she recovered from pneumonia. I didn't really have any reason to complain about the ward, except that one night I went in and I noticed that her food was on the side, and when I said she hasn't been fed, they said, oh, we haven't got time. But anyway, she recovered from the pneumonia, and she was moved from the accident emergency side ward. She was moved to an upstairs ward. I think within like about 1 or 2 days of being taken to the upstairs ward. My sister and I were visiting Mum, and we were called into an office with a doctor, Dr. Angela. Excuse me, I need to get the tissue. So within 1 to 2 days of being taken into the ward, we were called into an office with a Dr. Angela, and my sister and I, we sort of thought we were going to speak generally about Mum's care, and we were told that, oh, your mother's dying. And I can remember, like, we had no indication that she was dying. As far as we were concerned, she'd recovered. And it's sort of like, I don't know, it's like a feeling of shock. Like, how can you just say someone's dying when you see no signs of them dying? And she started talking to us about what we wanted to happen to Mum. And at the time, I didn't think to question it, because I thought, I had no idea of people being put on end of life. I had no idea of this happening in hospitals. I had no idea that my mum was dying. So it was all a bit of a shock. So I didn't think to say, well, what is she dying of? And neither did my sister.
Yeah, John and me, we were really close. I was lucky. I am blessed to be here today, because I was born between Stephen and Paul, who both didn't see their 16th birthday. They both died of muscular dystrophy. So I am very blessed to be alive. John was my oldest brother. John was my last brother I had before this terrible disaster what's happened here in Liverpool. So as you can see, I'm clinging to John even there. We were so close. Like I say, brothers being brothers, siblings, we had our rivalries, but we played in groups together and we were very, very close. Lost my mum the 22nd of March 2019. Yeah, my mum died. Alzheimer's disease. She'd had a fall and tragically lost my mum. I was absolutely devastated, because I'd already lost my 2 brothers. Then I lost my mum. And the only person who was ever there for me was John. John gave me comfort after my mum died, right up until he died 14 months later. John died at Aintree Hospital, Liverpool, the 5th of May 2020. The circumstances, I don't know, but it was a terrible experience, and I'm still grief-stricken. 5 years, it's more or less 5 years, coming up to 5 years to the day since he went in hospital. But the lockdown was the beginning of the end. Now, John had such respect and trust in the NHS, and as the lockdown happened, John rang me up and said, Tony, I'm not feeling so good. I said, Johnny, all right? I said, do you want me to bring you a bottle of brandy? Have a bottle of brandy. Tony, we're under lockdown. Don't come near. Now, once again, he's my hero. He was even protecting me during the lockdown. He sacrificed his life, basically, not wanting anyone to go near him. And what happened with John is, over the time, he was getting worse, and I was speaking to him. He said, I've rang an hospital, I've rang for an ambulance. Waited over a week for an ambulance, John did. But the significance is, in the meantime, up to when the ambulance did come. Because what happened is he was getting advice from the NHS helpline. The NHS The NHS helpline, I believe, misdiagnosed John's illness. They told John under no circumstances to go outside the door. We were under lockdown. They told John to go to bed, shut the windows and shut the curtains and self-isolate. John took this advice.
We're basically the Ormond family. John, Junior, Wes and Lolly. Everyone calls me Lolly. It was John Ormrod Senior that was murdered with midazolam and morphine. He was 88 years old, and that was back in 2022. Wes is his youngest son, John is his middle son, and I'm the wife of Wes. So, yeah, this is our story. So where shall we begin?
Restart.
Okay. Well, basically it all began back in January 2022. Dad had got a chest infection and his oxygen levels had dropped a little bit lower than we was comfortable with. So Dad was clued up with what was going on in the care homes and stuff. He was well versed with the midazolam and morphine thing and what have you. So he didn't really want to go anywhere near a hospital, but it come to the point where he admitted his chest was a bit bad, and yeah, he says, well, to be fair, I think you need to call him. We was kind of hoping somebody would come in, just give him a bit of oxygen and he'd be well away. But obviously that wasn't the case. He had the ambulance people come in and they said, yeah, you do need, it's a little bit low. They joked and said, you've won a stay in George Eliot Hospital. You've won an overnight stay.
Some joke.
That wasn't a joke because basically, yeah, he never returned.
Well, obviously we're here to talk about the death of my dad in 2021, October the 21st. You know, in hospital under suspicious circumstances. I'll start right back from at the beginning. So, my dad had an episode in here. We don't know what it was. We still haven't, to this day, actually been told exactly what was up with him. All we know is he blank expression, couldn't control his bladder. We conversed it. You were here, and we didn't know what to do. So we phoned 111. They said, phone 999, which we did. So he was in hospital. When he eventually went into hospital, he was in a corridor on a bed for about 13 hours. As Darren's just said, his partner did stay with him for initially the first part of him being there. Then I went and took over. And like I said, he was still in the corridor for about 13, 14 hours. Seen by a doctor. The doctor then did they checked him over, put him in for an x-ray on his chest and said, oh, he's got a slight infection on his chest. So, okay then, that's fine. Possible water infection, but they said he had a slight chest infection. Which is a bit strange because what I remember, because I know it's a long time ago now, but what I can remember is him not being unwell, not coughing or anything like that. So I don't know. It's just odd, you know what I mean? Eventually being put onto a holding ward afterwards, to where, and he was quite poorly. Was put into a holding ward in the hospital. We were there then. Do you want me to speak about that the nurse and the...
I mean, with this whole thing, I mean, it's you can go into every detail, but it's a little bit. I'm not saying it's pointless, but basically, he had an episode here. I can't remember we sat here, and I think he said when Lisa was there, or Lisa was on the phone to our staff in Australia, and my dad suddenly went like this. And Lisa, get me up. So I think that was the start of it. And it was just after his shingles jab. I think it was the same day. So that was the start of it. And so everything else after that, really, when they went into hospital, they never really diagnosed. And I'd say initially they said, that he came to us at one point and said he got brain cancer or cancer. And we were told that. And then it sort of went from, you know about the different types, stroke sort of things that they mentioned, but what we're saying was that there's episodes in hospital where it just got worse. There was never then, oh yeah, this wrong, your dad, he's going into that ward, we're going to do this, we're going to do that. They just didn't have a clue.
How long was he in hospital for from the day he went in?
So he went in on the Sunday, and then he came out a week on the Tuesday. I don't know if I remember that is because it was your birthday, which is the 6th of October. So he went in on the 20. So we had the party there on the Monday for my mum's birthday. Yeah. It was the Wednesday, which would have been the 6th.
I had a phone call say your dad can come out, come and pick him up, which we were happy about, but they were confident that they could let him out. But like saying this time, them 3 weeks, it was sort of, we were going in most days, make sure he got hydrated and stuff like that.
And you were allowed in?
We just walked in. We just went into ward. We just wait for a nurse to come out of ward and go in. Yeah, they were fine. Nurses were fine with us.
When he was placed in the holding ward so we went in on the Sunday, he was placed in a holding ward on the Monday. I was getting my story straight, but I know where I am now. Placed in a holding ward on the Monday. He was then taken for a CT scan on the Wednesday. This was to ascertain, what was going on, because he was showing some signs of confusion. I won't say delirium, but not fully there. A bit of what do they call it? Not blank expressions, but vacant seizures. You know what I mean? Just it'd be like that. The next minute, he'd be just staring into space. So we went in for a CT scan on the Wednesday. I got a phone call then to say your dad's had a CT scan. He's got a brain tumour. Now my wife was sat next to me at the time, and I just was shocked as if like from a CT scan they knew straight away that it was a brain tumour. We have no medical background, but like I said, we've got certain members of our family who are doctors and nurses and are part of the NHS, and straight away from a CT scan you don't know something is something without further investigation. So I just said to them, so you know from a CT scan that he's got a brain tumour? Yeah, it was the words that they used, it was a malignant brain tumour, which was really got me like going, this is odd. So I tells all the family, looks like dad's got a brain tumour. Sort of would explain, the cognitive issues that he'd been having over the last couple of days. So they sort of said to me, right, your dad's booked in now to the Walton Centre, but we're going to do a PET scan on Friday to check, because of his age, he was 77, to check where there's any cancer anywhere else in his body. The likelihood is it wouldn't have started in his brain. It's probably come from somewhere else. So I waited then till the Friday, and his consultant phoned me up and said, right, we've done the PET scan and your dad's got no cancer anywhere in his body. So now we're not so sure that it's a tumour. We think it might be a blood clot. So I was like, okay, great news at the time. We were thinking, this is fantastic news. I told all the family he'd had cancer. Now I was able to tell them he hasn't got cancer. He's got a potential blood clot. So it's going to have an MRI on the Sunday, and we'll know then what we're dealing with. So I get a phone call from a junior doctor then on the Sunday to say that my dad, cut a long story short, your dad's had a bleed on the brain due to a what do they call it? The other bleed on the brain due to a hemorrhage. Not a hemorrhage. No, I can't remember what it's called now. So the ischemic stroke is where he's got a blood clot The other stroke is down to him having a bleed on the brain. I can't remember what the name of it's called now.
Didn't they sort of half diagnose one and then give him the wrong medication, so it was the other one, which is what's made it worse, because we were giving him the wrong medication.
Yeah, so they said he'd had a bleed on the brain. They said he should make a full recovery and he will be out by the Friday.
So how it first started was my dad had passed away, so my mum was at home grieving my dad straight away, really. So she'd been in bed for, I'd say, probably about 4 days, and you could just tell she was grieving. So it was unusual for her, so my sister and brother called the ambulance just to have her checked out, because they thought it's not normal. So they called the ambulance. The ambulance come, they checked her oxygen levels, they were 99%, and they said, you might have a slight infection, you can come into the hospital. So she went to the hospital, and she was ringing my brother up and said there's people in the hospital, double vaccinated, single vaccinated, basically. And she was fine, and she said she'll be coming home. So then afterwards we never heard nothing from her at all. So they'd obviously taken her phone and given her morphine. So when we went down to the hospital, we could see that she was drowsy, and she was waving through the window at us, you know, drowsy. So I said to the doctor, why are you giving her morphine? And they said they give her morphine for an uncomfortable mask.
We'd known, both myself and my sister, and also my father, that Mum had shown signs of dementia for at least the last 5 or 6 years. We kind of noticed it, which, you know, she was in her 80s, and we all know that it's an increasingly common issue because the population is ageing. It was ignored by... My father was very protective of my mother. He didn't want to accept it. I understand that. And I understand that my mother didn't want to either. So they refused all kind of help. We had to go by the back door to get her an assessment, because they basically refused to have carers come in to do an assessment. She refused to go to the GP surgery to get a mental assessment that they do, memory assessment, I think it is. So because they didn't have any help or any support, my dad was adamant, I can look after your mother by myself, you know, just leave us alone, we'll be fine, all the rest of it. And as we know, with dementia, there is no cure, and it does progressively get worse. So that was quite noticeable, but it had accelerated quite rapidly in the last 18 months. You know, they'd come and visit, and Mother, she wasn't there. She'd be there for a few minutes, and then she wasn't there. She'd just be standing, staring randomly at things. She started to get very frustrated, which I understand, and aggressive, and then started being violent towards my father. Now, where my dad still lives, they've got quite a nice big house in a little village in Buckinghamshire with no immediate facilities. You have to drive 2 miles to get to even the smallest shop. So they were quite isolated. And because my father and my mother refused any help, Mum deteriorated quite rapidly. They had no downstairs washing facilities. Mum couldn't get up and down the stairs. My son, who is a carpenter, actually went over there to make sure that he put in like stability stuff on the stairs to help her get up the stairs. Dad was adamant that Mum could cope. She obviously couldn't.
And I didn't know this, but I just phoned to say hello. This was last December. I just phoned up to say hi, Dad, hi, Mum, how are you? And Dad was like, oh, Mum had some kind of episode. She fell, and I didn't know what to do, so I went to the next door neighbour. He had a medical background as well, so we think she's had a stroke. So he managed to manhandle her down the stairs because she collapsed upstairs. And they said she needs to go to hospital, and they said basically she's had a stroke.
Yeah, both my parents lived independently in their own home in a bungalow in Billinge, and they used to go on the bus daily. So then lockdown came, that was March 2020, and things just changed dramatically. My dad's mental health declined significantly. He wasn't remembering anything, and he'd do like bizarre little things. My mum's mental health had declined as well, and obviously we couldn't go in. She wouldn't let anyone in because she was scared, really. And with the news saying about the virus, my mum was that paranoid. She shut the windows, thinking the virus had come in, even though it was like glorious sunshine and 20 degrees outside. It was so terrifying, and it was awful to see that this had got a grip on my parents. You know, I could see the decline going. She'd give me a shopping list sort of through the door quickly, and I'd pick it up. So that was March, it carried on. So it took a big toll on my mum. So in June, my mum got pneumonia. She'd got run down, basically, and she had to go in hospital for 5 days. We treated at Wisdom for pneumonia, and low sodium, low potassium, which affected her. She ended up with delirium, which wasn't nice. Then Dad, we couldn't leave him on his own. He was prone to falls and his dementia.
I sat down with Ken McCarthy, author of Fauci's First Fraud, Unravelling the COVID Con, and What the Nurses Saw, to discuss the death protocols that were implemented worldwide. Ken had been quick off the mark on COVID, as he had seen the same playbook Anthony Fauci had used in the so-called AIDS epidemic, where a poisonous drug like AZT was rolled out that he had the patents and royalties for. The same thing happened with Anthony Fauci releasing the failed drug remdesivir to treat COVID-19.
And when you consider that they say over 1 million people died of COVID in the United States, which of course is not a reliable number, but let's accept their number. That means that over 900,000 people died while a hospital was supposedly caring for them, and that suggests a lot of people died as a result of the protocols, which we can get into in detail.
Yeah, absolutely. And those protocols sort of range from remdesivir to ventilators to midazolam and morphine, and to do not resuscitate orders, didn't they? And yeah, I mean, your book has a fascinating case where it goes example, where it delves into sort of the realm of the absurd. I'm thinking of that one nurse in your book who they labelled a patient, who they wrote on this file, candidate for long-term care. She understood that to mean to be a code for like fast track to a ventilator and remdesivir. So she ended up sticking him by an exit, calling his family and trying to get him out of the hospital.
Yeah, there was a lot of coded language for sure. And so the nurses that I interviewed, some of them were involved in literally rescuing patients. And the protocol in the United States was as follows. Regardless of what you came in with to the hospital, they would test you for COVID. And, the test was completely ridiculous. But occasionally it showed positive. So what they would do is they would test people in hospital if over and over again until they got a positive result. Okay. Now this was incentivized by the federal government, because if you treated a COVID patient in a hospital, you got a special bonus payment from the federal government here in the United States. Once you were declared a COVID, you might have come in with a gunshot wound. You might have come in with a kidney failure. You could have come in with any one of thousands of ailments. But once you were found positive from a COVID test, you entered into an alternate medical and legal reality, right? Number one, you were put into a COVID ward, a special COVID ward, and all kinds of things went on. The very first thing that went on, which I only learned when I did the book, this never hit the news media, this never hit the alternative news media. If you were declared to have COVID, you were prohibited from receiving anti-inflammatories. Something as simple as ibuprofen. In this country, we have a big brand called Advil. I don't know what they call it in other parts of the world, but this is a very traditional, always used, non-controversial, treatment. And if you quote had COVID, you were not allowed to get ibuprofen. The other thing that people who have respiratory distress are often treated with is inhalable steroids. So this is the standard care for respiratory distress. If you're having breathing problems that are severe enough for you to be in a hospital, the very first thing they do is try to knock down the inflammation, and accompanying that, they give you these steroids, which sort of fortify the body and help you throw off whatever the problem is. Those were banned for anybody that had a COVID diagnosis. So this would be the equivalent of a house on fire. The firemen arrive, they take out the hose, they're ready to, hose down the house, and they're told, nope, you just have to sit back and watch this house burn. We have a new protocol. The next part of the protocol, and it went, it wasn't necessarily this exact sequence. Sometimes they did it in different orders, but a very important part of the sequence was to offer tranquilizers. In other words, would you like something to help you with your anxiety? Now imagine how anxious someone would be if they've been just diagnosed with COVID. They've been watching the news for months, being told that COVID is a death sentence and there's no treatment and there's no cure. And now they're locked away in a COVID ward and they can't leave. And everybody around them is masked up. I mean, I would probably be anxious myself. And so one of the very first things these patients were treated to was an offer for basically tranquilizers. Now, two things. One, if you take a tranquilizer, you are relaxing your muscles. Your diaphragm, which allows you to breathe, is a muscle. So there will be reduced respiration when you're on a tranquilizer, okay? The second thing, and I don't know how it is in the UK, but in the US, once you've accepted a drug like that, you are now in a different legal class, right? So typically, if you want to walk out of a hospital, you can walk out of a hospital. But now, you've now accepted a psychoactive substance because you've claimed you have a psychiatric disorder. Anxiety apparently is we're being worried about your situation is now a psychiatric disorder, and they can now hold you against your will for a period of time. So that was the next part of the protocol. So another stage of the protocol was non-invasive ventilation. And what this is they put a mask on your face, they attach it very tightly to you, and they basically force air at a high rate down your lungs. And this is very uncomfortable. This is very anxiety provoking if you don't know what it is. And again, in the pre-COVID world, the way this is done is somebody is told, hey, it looks like you're having problems breathing. We'd like to try this on you. We think it might help. It's a little bit harsh. We'll be here. If you have any problems, just let us know. That's the normal way it's done. During COVID, they would not tell anybody anything. They'd slap this thing on their face, crank it up, and leave the room and leave the person by themselves. It's sort of like the equivalent of if a car's going 100 miles an hour, sticking your head out the window. That kind of, except it's going straight down into your lungs. Now, if a person became anxious after that, right, then they'd ply them with tranquilizers again. The next thing they would do is tell them that there is a treatment, and it's the approved treatment. It's called remdesivir. And remdesivir was a drug that was experimented with in Africa during the so-called Ebola outbreaks there. And they quickly withdrew it from use. And one of the reasons they withdrew it from use is one of the adverse reactions to remdesivir is that it causes kidney failure and liver damage. And this drug was withdrawn from use. And yet somehow it got revived and became suddenly the one and the only treatment that anybody could receive for COVID. So it's delivered in a bag, and the bag is hung, and then an intravenous is put into your arm, and they just drain this bag of, pretty toxic substance into your bloodstream. Now, in the U.S., the hospitals, which are privately owned, they're owned by corporations, they were given incentives for every course of remdesivir that they gave people. So this was immediately being given to everybody. I have a colleague who's done the statistics on death rates. I think it was in New Hampshire and Minnesota. And as soon as remdesivir was introduced, suddenly you had people dying of kidney failure. You could see the spike. It's not subtle. It's an absolute spike. So educated nurses saw this and they said, "Oh, this is not good. We've just seen 3, 4, 5 patients die after being given a course of remdesivir." And those who refused to continue to give it were disciplined. They were fired in some cases. And if they continued to talk, they were actually sort of trolled on the internet, attacked, doxxed, having their name and address given out to basically unhinged people.
In the NG191 document, the failed drug remdesivir is advocated for treating COVID-19. Similar to Anti-Fauci's toxic poison drug AZT during the alleged AIDS epidemic, remdesivir was a failed drug to begin with. The World Health Organization recognized its failure to treat COVID in a now deleted webpage. However, as with AZT, remdesivir was Anthony Fauci's cash cow and rushed to the market, whereby it quickly killed people with organ failure.
So that was another thing that they did, was to give remdesivir to everybody, and it was a profit center. And then the last thing that they did was to do invasive ventilation, and this involves literally putting a pipe down somebody's trachea into their bronchial area, and it's called the garden hose, by people that do the work. It's not a trivial thing. In order to be invasively vented, you have to be knocked out. You have to get a course of analgesics, which might include fentanyl. In fact, did in many, if not most cases. And you also had to be given antiparalytic drugs. These are drugs that keep you from moving, basically. And these are not pills. These are intravenous drugs delivered by a tube from a hung bag. And you could be receiving anywhere from 3 to 5 to 12 different bags. You're knocked out, and you are basically in a vegetative state. You obviously can't feed yourself, so you're fed by a tube. You can't clean yourself, so you are 100% dependent on the people around you to clean you. And one of the problems was in the U.S. hospitals, there was such hysteria and panic among the medical staff and nurses that patients were not being cleaned. All right, so this was a recipe for disaster. And under normal circumstances, invasive ventilation is only used as a last resort because it is a dangerous procedure and it is an injurious procedure. It has the potential to be injurious. So the name of in the U.S., the folks that handle this are called ventilation. They're called respiratory therapists, and their job is to monitor the patient carefully, make sure they're okay, and to, as soon as possible, starting within 24 hours, see if the patient is strong enough to take them off the invasive ventilation. This is another example of a medical protocol being thrown out the window and a brand new protocol that never before seen on earth being implemented. And the idea was to keep people on the vents indefinitely, basically. The federal government, again, had an incentive program. And if you kept somebody on the vent for at least 96 hours, and again, this goes against all medical practice, if you keep them on for at least 96 hours, you received an additional bonus. So you got bonuses when you declared somebody a COVID patient. You got bonuses when you put them on remdesivir. You got bonuses when you put them on the invasive ventilation. And you got bonuses if you kept them on the ventilation for at least 96 hours. And in terms of remdesivir, you got bonused for every course. Not every bag, but every series of courses, every series of bags. Okay, every series of bags constitutes a course. So not only did you get paid by the bag, you got paid for completing a course. We know of at least one case where one patient was given 3 separate courses of remdesivir, and he died of organ failure. And this was something that you may have heard this from the families as well, because after my book came out, I had focused on nurses, but after the book came out, I was being contacted by families, and I had a lot of conversations with families. And a very common comment was, we did not even recognize him or her. The body was in such terrible condition when the body was given over to us. So that was the protocol. It was, somebody conceived it at the federal government level. Somebody worked out the financial incentive programs. Somebody communicated those financial incentive programs to all the hospitals. The CFOs, that's the chief financial officers, and the executives who run those hospitals, who are very profit oriented, saw those incentives. And I asked many nurses, who runs the hospital? Is it the doctors? Is it the nurses? And they are all very clear. The doctors and nurses do not run the hospital. They are answerable to the hospital administrators. And the hospital administrator can fire you, can blackball you, so that you not only can't work in that hospital, you can't work in any hospital. And in the case of COVID, and probably in other cases too, but in COVID, it's absolutely clear, the financial incentive was the driving force, and everybody was told, use these protocols, period. Don't ask about them, don't question them, don't discuss them. And if you refuse to do them, you're out of here. And this occurred all over the country in the United States. Now, I asked late in the process of interviewing the nurses, I said, what percentage of nurses actually pushed back on this? And they were reluctant to give an answer. And you have to understand, these are traumatized people, right? And when I asked them to recount all the things they went through, I was asking a lot. It's like asking a military veteran, a battle veteran, combat veteran, hey, tell me about, such and such an episode. It's not a pleasant thing to recount. So they were reluctant to talk about how many nurses did or didn't push back, but I pushed a little bit because I needed an answer. And so I floated a number. I said, was it 10%? And they all said no, it was a whole lot less. So basically, at least 90% of the nurses, probably 95%, maybe 99%, went along with these protocols, watched patients get seriously injured and die, and continued to apply the same protocol.
In Britain, the infamous NG163 and NG191 became the backbone of government protocols for death pathways. The NG163 document is no longer available on the web, however we can access it via archive.org. Under special considerations, we can read the following stunning statement. Sedation opioid use should not be withheld because of a fear of causing respiratory depression. Whilst we go to the US National Library of Medicine, we're reading about midazolam, we can read, midazolam injection may cause serious or life-threatening breathing problems, such as shallow, slowed, or temporarily stopped breathing, that may lead to permanent brain injury or death. You should only receive this medication in a hospital or doctor's office that has the equipment that is needed to monitor your heart and lungs and to provide life-saving medical treatment quickly if your breathing slows or stops. Whilst the British National Institute for Health and Care Excellence, NICE, states, the MHRA reminds healthcare professionals that benzodiazepines and benzodiazepine-like drugs co-prescribed with opioids can produce additive CNS depressant effects, thereby increasing the risk of sedation, respiratory depression, coma, and death. Healthcare professionals are advised to only co-prescribe if there is no alternative, and if necessary, the lowest possible doses should be given for the shortest duration. If methadone is co-prescribed with a benzodiazepine or benzodiazepine-like drug, the respiratory depressant effect of methadone may be delayed. Patients should be monitored for at least 2 weeks after initiation of changes in prescribing. So how did government policy to treat a respiratory illness involve drugs that can potentially cause shallowed, slowed, temporarily stopped breathing, and death? Were you aware of the protocols at the time, like the NG163?
Yeah, to be honest with you, my heart completely sank as soon as they used the word COVID and IC, because I knew straight away what that would entail. And then I kind of think to myself, like, why didn't we do more? Like, why did we allow that to happen?
When we kind of knew all of this. Like, why did we put our trust in them? But you do, don't you? You do put your trust in.
And then you're kind of torn between, like, no, it can't, like, this can't be, to actually, it is what it is what I believe. And, I know people that have worked on these wards, and they say things like, you go in there, you don't come out again. It is a death sentence. So, whatever that protocol is, it's not making you better, it's making you worse, and it's making you, well, you're going to end up dead, basically.
And you believe that your dad knew, do you think he knew that he was being put on this sort of pathway to death? Do you think he was...
I think he did.
I think that's why he was so scared. That's why he rang up saying, get me out of here now. You know, and I feel guilty because I was like, Dad, just calm down, you know, you need to listen, like, they're there to look after you. So there's a level of guilt from my side because I'm like, well, I should have listened to my dad. Why did I let them do that to him?
You kind of think, like, what were they saying to him? You know, why was he so agitated? You know, because to start with, he was okay. He was managing, and then it just seemed to spiral, didn't it? It was like, what are you saying to our dad to make him, like, just panic so much?
I just thought at first, because Dad didn't like hospitals or doctors, like, he wouldn't go to the doctors, or he was always, like, kind of scared of that side of things. So I just thought, oh, it's Dad just being a bit... But actually now I realise that there's so much more to the story, and I wasn't aware of that at the time.
It's made us lose complete faith in the NHS and hospitals. You know, recently our mum had to go into hospital just before Christmas last year with some type of flu, and it just literally, it's like post-traumatic stress, like, the whole time.
You want to do COVID tests and you're like, no, because you're scared that she's going to follow the same protocol.
Well, it is still happening.
Exactly.
I spoke to someone last week whose mum's just been killed in hospital. So they're still doing it. It did seem to be a lot more prevalent in, like, 2021, but it is still happening.
I guess it probably depends on the hospital or whatever, but, like, we spoke to, because they kept pushing for this COVID test, and we was like, you know, what's the protocol then? Because they were saying things like, well, because you won't have a COVID test, you're putting vulnerable people at risk, so we're going to stick you in a side room. And then we was like, well, what's the protocol now? And they said, well, there isn't one.
Of course, since then you've met other people who've been through similar experiences.
Yeah.
And many of them have gone to the police and just got nowhere, so that just backs up what you suspected in the first place.
Yeah, I think it's good. Like I say, it's similar to the infected blood, even the post office scandal. They know these things have come from higher levels, like say the protocol NG163, Matt Hancock's thing. So this stuff comes from the top, and it always goes back to Parliament, really.
Do you believe that the COVID protocols, including NG163, were ramped up at the start?
Definitely, and it's still going on, Jackie. It is still going on.
Speaking to people on a weekly basis. Stories.
I mean, I can't say too much, to be honest. We've had a recent experience of a close family member, for legal reasons, I can't go into it, who passed away. Similar thing as Dad, who went in with, had a fall, broke a hip, but was rectified right away, that they had a walking again and everything. But medical negligence occurred very soon after, in fact within 2 weeks of admission with a broken hip. Hospital-acquired pneumonia was brought into it. Do not resuscitate. The same pattern as Dad. That's how I knew.
So I'm curious, because everyone that seems to go into the hospital, I was curious because they were not coming out. They were dying. So I said to her, so what happened? Because I'm curious, what happened? And she said to me, they injected something in my groin and they're just trying to keep me in here. So from then I knew something, and if I had a phone I would have recorded her to find out what else happened. But
what year was this?
This was 21. So literally she said that to me, and so I knew, because if she had passed away without me talking to her and her not telling me this, I wouldn't have been sure. I couldn't be 100% sure. But when she told me they're trying to keep me in here, there was nothing wrong with me, they injected something in my groin, I knew straight away that they had done something. So, so then obviously her SAT levels were low, and it's because they were giving her morphine, putting the oxygen mask on her, so she couldn't do nothing because she was drowsed up. So the other thing she said to my sister, which rung bells, was she said that they were letting her wet the bed, but she had a catheter in. So when did they put the catheter in? After they drugged her and put a catheter in? So I knew there was something wrong there. So in the end, my sister stayed there, and then they gave her an injection, and then obviously killed her off. So they were giving her morphine and midazolam, and they gave her that to kill her off. But I don't know whether, if we took her out of there, what would have happened. You're in a situation where you don't know what's going to happen because her SAT levels were low after the treatment that they'd given her, the morphine, the mask, the midazolam. So there was really nothing we could do.
Yeah. Do you know the dosages of the morphine and midazolam they gave?
I'm not 100% with the dosages. We did took something down. I've got a book that I've put everything in the notes. So I've got all the drugs that they were giving her and everything. But even while she was there, they said to her that if we take you off if you take the mask off, you'll die.
Right.
So they were scaring her into taking the drugs and telling her. I mean, I don't know who would tell someone they're going to die if they knew they were going to die. You know, no one. If someone's dying, no nurse will go and say, "Oh, you're going to die." And that's what they did. So.
So do you know if she'd been put on an end-of-life pathway?
Yes, yeah, they had. They put her on it. They said she was 76, she's coming to the end of her life. And my mum was nothing like it. She had nothing wrong with her at all. She was as fit as me, and the only thing she was doing was grieving my dad. So, you know, even if she had cancer or something like that, there was nothing wrong with her at all. Nothing. So they literally killed her, gave her end of life. And all they could say is she's 76 years old, she's coming to the end of her life, when she wasn't. And she was fine.
Did they actually say that?
Yeah. They said she's 76 years old, she's coming to the end of her life. And we know our mum, you know, she was nowhere near going to die. Nothing at all wrong with her. So it's just what they did. And she went in with 99% oxygen levels, and then the doctor tried to make out that when she got to the hospital that it dropped to 70-something. And then when she went in, it went down even more. But she'd been grieving for 4 days. Why didn't it go down then? So she had 99% oxygen levels when she was taken in the ambulance. So I know what they did to her in that hospital. And for the nurse to be not even looking at me in the eye, she just could not look me in the eye. And then she went off. So they knew that what they were doing. You know, some people might say, was it negligent? It wasn't negligence. I could never put it down to that. It was deliberate what they did. Deliberate. There's no way it was negligence. It was deliberate.
And the thirst she had, was that because they had withdrawn fluid and food, you reckon?
Yes. We noticed that, you know, normally you get a drip.
Yeah.
She didn't have that. So my aunt was a nurse, and she said, "You've not even given her a drip." And then when they said that, they said, "Oh, we're giving it to her orally." So when are they going to give it to her orally? They're going to take the mask off and say, "Here, I have some water." They weren't giving it to her orally. So they didn't have the drip on her, didn't have nothing, so they weren't giving her fluids at all. So, that was another thing.
Did you suspect something straight away, or did it come later?
No, I suspected straight away. As I went into the hospital and I saw that she was all drowsy, and they said they were giving her morphine for an uncomfortable mask, to me that didn't make sense. You know, people will get morphine when they're in pain, if they've broken an arm or broken a leg or something. But for an uncomfortable mask, give them morphine. They tried to con my sister by saying that we're giving her, like they were doing her a favour. But they gave her the morphine to make her drowsy so they could do whatever they wanted to do. And you just could tell that.
What did your sister make of it?
Oh, she knew the same thing now. She knows now. And then when my mum was there and said what she said, she looked at me as if to say, "Can't believe this." I would never have expected it from normal hospital. You expect it from backstreet hospitals, but not a big hospital. But now I know what's happening in the hospitals then, because several of my dad's friends went in and didn't come out. So I was thinking, what's so bad that's killing these people? And now I know, because my mum told me, they were killing the people in the hospitals.
And I take it you're aware of the protocols like NG163 now?
Yeah, I've heard of the protocol. Yeah. I mean, the thing is, I would like to say that there is some good people, nurses in the hospitals, but there was a certain group of people doing this, killing people. Whereas, I can't blame the whole hospital, but because I know there is some good nurses and good doctors out there doing the right thing, but there is that side, there was people doing the wrong thing, killing people.
And so then came the introduction of Do Not Resuscitate, DNR notices, death sentences slammed on the medical records of countless millions of patients. When DNR notices were first introduced, the idea was to temper scientific advances with a little genuine kindness and concern for the welfare of patients. Medical science had reached a point whereby patients could be kept alive long after real hope had disappeared. In the beginning, DNR notices were introduced with good intentions. The idea was that patients who were dying and beyond help would not be resuscitated time and time again, simply delaying the inevitable and putting comatose patients and distraught relatives through endless pain. Around the world, millions of comatose and brain-dead patients would still be alive today, kept breathing by machines and without hope of recovery, if the principle of DNR had not been quietly introduced. But today, Do Not Resuscitate notices are routinely slapped on the medical notes of patients who are awaiting surgery for entirely curable problems or who are simply old, by which they mean they're over 50, or disabled, or ill, or suffering from mental illness. Even young adults and children have been labelled Do Not Resuscitate if a doctor or nurse felt that their lives were in some way worthless. The medical establishment had by then deliberately and cold-bloodedly taken the caring out of medicine. But the decline in caring came to a head during the COVID fraud. It was then that the medical establishment decided that the Liverpool Care Pathway wasn't killing people fast enough, and that the DNR notices just weren't fast enough either. Most people became aware that doctors were deliberately killing their patients during the COVID lockdowns of 2020, when doctors began systematically, deliberately, and cold-bloodedly murdering old people in care homes using a kill shot injection consisting of midazolam and morphine. What else do you call it but murder when patients are deliberately killed to save money? As I warned in February and March of 2020, the alleged COVID pandemic was a hoax. The science and the statistics showed that COVID was nothing more than a remarketed annual flu. It was no surprise that in 2020 there was no official flu. That's because everyone who had COVID actually had the flu. People forget that worldwide up to 600,000 people can die in an annual flu season. Governments around the world try to fiddle the figures to show that COVID was killing millions. It wasn't. People who died of heart attacks or cancer or accidents in the street were all put down as COVID victims. As everyone now knows, it was a massive fraud. The extra deaths were a result of the lockdowns, which were never justified, and later the toxic vaccine, which I had warned was coming right at the start of 2020. It was obvious too that they'd try to make it compulsory.
I was angry because the things that I read in his notes wasn't what the doctors were saying to me on a daily basis. The doctors were lying to me on a daily basis. Nurses were lying to me on a daily basis. Everything that was in my brother's notes was different from what I was being told on a daily basis.
I think you say at paragraph 25 that he developed a ventilator-associated pneumonia, or VAP.
Yeah, so
is that something you found out afterwards?
Yeah, so I had a friend whose husband had also been in hospital with COVID, and he was on maximum oxygen for 3 weeks. So what I couldn't understand is why the ventilator was being pushed on my brother.
Thank you. I just want to move to a related topic, which is do not attempt cardiopulmonary resuscitation notices. Yeah. And you explain in your statement that all GPs have put in place DNA CPRs on their patients. Was that all of your patients in the care home?
Yeah. Yes. I came back from a meeting and 50% of them had already had the paperwork in place because they'd been sent to them, and then they had all had DNRs in place.
And was there, to your knowledge, any consultation with the patient or their families?
No. I managed to speak to some of the patients' relatives before this was slightly before lockdown. This was happening. This was before lockdown, and two of the relatives, I managed to get in touch with them, and they got hold of their GP, and it was removed because they didn't agree with it. They spoke to their parents about it, and they didn't want it in place either, and it was removed. That's the only two.
Prior to lockdown, if there were those notices in place, would nonetheless that individual be taken to hospital if necessary?
If what, sorry?
If there was a notice in place for an individual patient of yours, would they nonetheless be taken to hospital for treatment?
Yes.
Did you see any change in that during the pandemic?
Yes. We found that ambulance drivers and paramedics were not happy to transport any patients to hospital if that needs, like when that lady fell, unless there was a DNR in place. Okay. And I'd never come across that before. So that was a relatively new consequence to me.
Perhaps the greatest governmental policy failure of modern times. And then he continued with this. This failure resulted in the unnecessary deaths of tens of thousands of British citizens, including a generational slaughter within care homes, many of those victims dying horrible deaths, often without the solace of their loved ones. Understanding the true causes of this failure is, I believe, owed to the victims, their families, to history and to the future. CBFFJ calls out the callous way that family members were treated by politicians and policy makers, referring to them as bed blockers and people nearing the end regardless of the virus. This theme is exacerbated by the experience of many family members regarding inappropriate DNA CPRs and blanket visitation policies. The statement reflects that those in charge of policy lost their moral compass in dealing with those receiving care.
Something that we didn't mention actually was what came to us as a bit of a surprise when he got to Bedford Hospital was that Luton and Dunstable had put a DNR in place for Dad, which we was unaware of, but apparently we'd agreed to that, or Lisa had agreed to that, which wasn't the case. So that was a bit of a surprise to us.
Did you find any documentation with the DNR on?
Yeah, we so after Dad had passed, we asked for documentation from Bedford Hospital and Luton and Dunstable, and I found the DNR, and it basically said that I had consented to a DNR that was actually signed on the day that they put him on the ventilation machine, which was on the 8th. We knew nothing of it until Bedford had just happened to slip it into conversation not long before he died. So it was just a complete shock, wasn't it, really? It was almost like, so you'd already made the decision for him. You knew exactly what was going to happen, but what made it worse was obviously we then, you know, went through all of the medical notes.
That's when everything kind of unfolded to us, that actually there was more to the story. I mean, we kind of knew that there was something not right anyway, and we
always felt it from the very beginning. That something just didn't add up.
And actually, when we went in to see Dad, and the doctor at Bedford Hospital, we spoke to him and he took us into a room, didn't he? I kind of had this feeling that the doctor was also kind of aware of what had happened to Dad at Luton and Dunstable Hospital, and he was kind of, I don't know, I just got this feeling from him that he knew that what was done was wrong, basically.
And sort of advised to take it up with Luton and Dunstable as well, if we had a complaint. So when we got the medical notes and we went through all of it, we could clearly see that he obviously had blood tests when he went into A&E. He had exceptionally high glucose levels. I think it was like 29.
It was kind of,
but also he had a high level of ketones in his body, which is seriously dangerous. Basically means you can go into something called ketoacidosis, and it can result in you collapsing and going into a coma. So in my eyes, that's what happened. The treatment that they gave for COVID actually exasperated whatever else was going on, and that's clearly written in the medical notes.
From the diabetes nurse.
When the diabetic nurse eventually got round to him, which was like probably 5 days in.
But we did express every time we spoke to the nurses and the doctors that we believe that Dad's collapsed because he has an issue with his diabetes. The nurse that actually saw him, the diabetes specialist, said he was newly diagnosed. But we know that this had been going on for a lot longer, but they didn't listen to us. They just kept pushing, oh, he's got COVID, he needs to go to COVID ICU.
It's like they just made their mind up and that was it.
They weren't interested in the fact that
we knew him, we knew what was going on.
And that he had an issue with his diabetes.
They put him they induced him into a coma. They put him on a ventilator without any family consent. They induced John into a coma. I don't know what drugs that they give him, I don't know. This is why I would call for an inquest into everyone who is being placed on one of these ventilators, because they induced him into a coma. They put him on a ventilator without family consent. Then they decided to enforce a do not resuscitate policy. I said I want to come and see him. Mr. Jeffries, we're under lockdown. If you come anywhere near the hospital, we'll have no choice but to have you arrested.
And did you ever find out if you had a DNR put in place? A do not resuscitate?
So I think that the consultant doing the CPR, that was his way of trying to get me to agree without using the wording, the phrase DNR, thinking I was an idiot. But I knew, unfortunately, that their plan was to take Chris out very quickly, and they knew with the intoxicating of drugs giving to Chris that it would take an awful lot to create a heart attack to kill him. But that's what their aim was, and that's what they did. They did tell the mother sepsis and a heart attack. They told me a heart attack and a chest infection, and a chest infection he never had. They said they never found the secondary infection, that they didn't document the first infection. They just lied about a viral infection. I have the blood test results that prove that Chris not only never had COVID, he never had any viral infection whatsoever. On many blood tests, serum blood tests, but there was a blood test that the result came back the day after they killed him, which means 5 days before post-mortem. So all the staff involved knew that that blood test 1,000% reveals that Chris did not have COVID, and that doctor, that lead consultant, had no right whatsoever to say to the coroners not to do a full post-mortem because Chris died of COVID, when he knew in black and white from his own hospital lab that Chris did not have it. In fact, they took the blood test because I think the senior Dr. David last minute knew that Chris had a pulmonary embolus and wanted to treat him for it, but it was too late and he was going to give Chris a blood transfusion. And if you have the virus of any kind, you can't have a blood transfusion. Also, Chris' blood group was O positive, and for everybody out there, I want you all to know that if you are O positive, your chances of ever contracting the alleged COVID virus is minimal, and all medical people know this, but they don't tell you.
I don't know, so do you think that he was killed with the drugs?
I think he was killed with the ventilator and the drugs, and I think they were experimenting to see how much a big man of 6'2" could take before you die. That's what I think. And I think that's why they, on their documentation, they didn't put that they gave him ketamine 2 days in a row. I think they accidentally put down the propanol 2 days in a row. But because they've tampered with the evidence, the hospital are not really sure what they've sent me, what I've got and what I haven't got. But I do have quite a lot. And it's quite easy, once you get into it, to read what's happened, to read into it.
And do you think he was targeted because he was costing a lot of money, or do you think he was targeted because he was unvaccinated, or do you not think he was targeted?
Okay, I actually think he was targeted for all those reasons, because they're like legal drug pushers. The only medication that they mentioned in A&E was the vaccine, and they were trying to bully him into having it, constantly talking, and then on the paperwork it's written so many times, this unvaccinated gentleman, unvaccinated. And as for costing the government, he actually told me in front of his team that he decided to put Chris into palliative care because he was costing the government and the NHS far too much money.
Because from the moment he went in on the Thursday to the Friday, he now started showing signs of COVID or COVID pneumonia, there's, you know, the respiratory illness. He's breathing. So I just strongly denied. I said, there's absolutely no way that anyone in this family is going to accept that I do not resuscitate on me dad. And her words were, it's not your decision to make, it's our decision to make. And we will do what we think is the best course of action for your dad. But your dad will receive all and every treatment available to him. And that's what she said. Now, I had about 3 of those phone calls about the DNR with these doctors wanting to reiterate the fact that your dad's not going to be resuscitated if he dies, which again we strongly disagree with. It doesn't say that in his notes. It actually says that although unhappy, accepted the fact. That's one thing that I did not accept was a DNR for me dad.
The mass murder of the elderly was part of the depopulation plan. In March and April 2020, doctors said that they would simply refuse to see or treat old people. One GP told a care home manager that no one over the age of 75 would be admitted to hospital. Referrals by GPs for suspected cancer fell by 70%, as doctors abandoned their patients and their responsibilities. As the number of pensioners dying increased, government ministers openly boasted of the huge amounts of money that they were saving. They were saving on pensions that they didn't have to pay, and they were saving on medical care. The slaughter of the innocent, which occurred during 2020, was nothing more or less than a form of genocide. During the COVID lockdowns, launched in celebration of the remarketed, rebranded annual flu in 2020, thousands of old people were murdered. And that's not hyperbole. Thousands of elderly people were isolated from their families and friends and then deliberately murdered with kill shots of morphine and a benzodiazepine. The argument was that old people had to be kept out of hospitals so that the staff would be free to deal with younger patients who were suffering from COVID. I made a number of videos about the murders taking place in hospitals around the world back in 2020, and they were murders. What else do you call it when people are deliberately killed? Murder's murder, whether it's committed by a man with a gun or a nurse with a syringe. In fact, as is well known, doctors and nurses had so little to do during the COVID hoax that they spent their time rehearsing TikTok dance routines while the innocent elderly were being slaughtered. Specially built hospitals designed to cope with the avalanche of COVID patients were left empty and unused. Politicians boasted about the money that was being saved by killing off pensioners. Attempts to tell the truth about the deliberate cold-blooded fraud were suppressed by media organisations such as YouTube and the BBC, the staff of which will, in due course, be tried en masse for genocide. At least I hope so. I wouldn't trust medical advice by anyone now offering their views on these or any other mainstream channel.
I have ascertained that the sedative that she was given is one called midazolam.
That's correct.
And we've heard about midazolam from other witnesses, and I think it is associated with end-of-life care.
She was also given 2 other drugs that were part of an end-of-life protocol.
And what's your reaction to learning that?
I'm very angry and very upset about it.
You subsequently ascertained that there was a do not resuscitate notice in relation to your gran.
That's correct.
Can you just explain how you came by that information?
We had heard that there was a possibility that there was a do not resuscitate order. After my grandmother had died, we'd heard from the solicitors that there was talk that there was a do not resuscitate order in my gran's file, but nobody had ever seen it, so we didn't know the full facts of it. But when I actually sat with the inquiry team to give this statement, my solicitor produced the do not resuscitate order, and it had my name on it, and it was dated on the 2nd of November. And sorry? I've got a copy of it, but it's kind of block capital letters with my name.
So in other words, not your normal signature?
Not my signature at all.
We went into the hospital, and a particular doctor who we'd seen before about putting Mum on end of life, he asked us again, and we said no. We didn't want to put her on end of life because she seemed fine. And then he said, look, I need to know in the next 30 minutes. I need to know by 4:30 because I've got to leave the hospital because it's my weekend off. So I said, so what you're asking us to do, you're basically asking us if we agree to murdering my mother. And if we'll tell you in half an hour because you've got the weekend off. And he said, he didn't look surprised when I said that. He was just said, oh, well, don't think of it like that. He said, think of it as, we're saving her from pain and we're giving her a dignified death. And I started thinking, this guy, to have no empathy and to just don't think of it like that, when I've actually said, I think you're murdering my mother. This guy seems like a bit psychopathic or something. So on purpose, I actually said to him, so if we put Mum on end of life, what will happen? How soon will she die? And he went, it depends, he said, 2 or 3 days. Some people last longer, but well, say 3 days, very matter-of-factly. And I couldn't believe it. I couldn't believe that this man was a doctor and he could talk to someone like that, so matter-of-factly, about someone's mother.
Do not stop. Do not take no for an answer. Contact the Nursing and Midwifery Council. I can't speak for any other borough, but I know the London ones, London-based, and I hope all the others around the country are as fantastic as what they are here, because I am now at the legal stage with them. I would like you to know that when I sent my summary to them with evidence, I've learned a lot more since then. But I was then asked to rewrite a new summary because they knew it was murder. And they asked me to start it with, I believe the hospital murdered Chris because of the following. And that's their guidance to me. And that's my guidance to everybody. If you know it was murder, don't be afraid to use the word. Murder is murder.
Yeah, I actually, obviously we put together a complaint. We worked on it for a whole year, didn't we? And I also contacted the officer that actually was there at the scene when my dad collapsed, and he went to the hospital with him. And I just said, I just wanted to ask you some questions. And he was like, yeah, sure, how's your dad? And I was like, he's dead. And he was like, you're joking. What happened? I said, well, I beg to differ, but he got put on a COVID ICU ward, and that's what he died of. I said, did anyone contact you to let you know that he had COVID, that you was in contact with somebody that had COVID, you know, to see, so you could isolate? He was like, no, not at all. He was just in complete disarray and shock that was the outcome of that whole scenario. But yeah, so we put a complaint together. We had a meeting, didn't we, with Luton and Dunstable. We sent the complaint to Bedford as well. We wanted someone from Bedford to represent themselves as well, because we had questions to ask them. They never got back to us. Yeah, so we were saying about we put this complaint together, and with NHS PALS, we sent the complaint to Bedford PALS and Luton and Dunstable. Bedford never actually, they never got back to us, and I emailed them. They just never even acknowledged any of it. It was only Luton and Dunstable. So when a meeting was set up with Dr. Raja, because we kind of felt like he was the one that made a lot of the key decisions regarding Dad and all the key points in his hospital stay, and we had the hospital manager, I can't remember his name. Chris, yeah. Chris. And we specifically asked for somebody from Bedford to be present at the meeting, because, you know, obviously they had their version of events and we felt like they needed to be there. I
think especially the fact that they'd switched everything when
because they felt that they needed to do something different. Like, why was that? But Luton and Dunstable said that they will speak on behalf of Bedford, which we felt was a complete conflict of interest, because it's like, you're not them. Okay, you're all part of the same trust, but it's a different hospital. But it just was a big no-no. We had questions, didn't we? A lot of questions for the doctor. I kind of felt like he was spitting feathers, to be honest with you. I felt like he was nervous, he was agitated. And I remember saying to him, why did you feel it was appropriate to change his sedation medication from fentanyl and propofol to midazolam and morphine? And he said, well, you know, it was COVID protocol. And I was like, but why at that point? And he said, well, sometimes it can be because, you know, if we're running out of other medications. And I said, but the thing is, I said, he had a so-called respiratory problem, and you put him on drugs that suppress his respiratory. Why would you do that? And he turned around and he said, well, he was on a ventilator anyway.
And even the lady from Pals was a bit like afterwards, like...
I don't understand the answer to that question. That makes absolutely no sense. He's in there so you can make him better, get better.
They stopped using the ventilators in January 21 because they realised they were killing people. Because if you're put on a ventilator, you've got less than 20% chance of surviving a ventilator. They know that. How old was he when he died?
When John died, he was 65. His birthday was the 24th of September 1950, I think it's 1956. So he's the age I am now when he died. He's gone 5 years, more or less to the day now, 5 years he was in hospital fighting for his life, but in an induced coma and on a ventilator. So I don't know, but it's just been... my relationships with everyone suffer because people don't know how I feel, and I end up getting in arguments with people. I get called a conspiracy theorist, I get called a broken, emotional person, but I've lost my brother and I've never got no answers. I'd just like to know who made the decisions and why, and who benefited.
They did a tally in November 2020 and they found out that 18,562 residents of care homes died with COVID-19, well, so-called COVID-19. 18,168 aged 65 and over. And those represented 40% of all deaths, including COVID-19, during that period. And then of those deaths, 76%, which is around 13,000, happened in care homes themselves. Nearly all the remainder occurred in a hospital. So, yeah, the care homes were the killing fields over here. Unfortunately. Yeah, during the same period, 28,000 excess deaths were recorded in care homes in England. So,
and then they turn it around and attribute it to COVID.
Yeah, so they slapped COVID on a lot of these death certificates. Like a bunch of the families I interviewed, they refused to sign the death certificate because it had COVID written on it, and they were convinced that they hadn't died of COVID.
Oh, we had the same thing here too. Absolutely. In fact, I believe there was a case where a doctor who was also a state assemblyman, he reported that he got a letter from his state medical board instructing them to put COVID on everything. You know, it's interesting. We had a Nuremberg trial after World War II, and the leaders of the Nazi Party were tried, and business people. There was a separate set of trials for business people, and there was a separate set of trials for doctors and nurses. And it was very small, by the way. It was a very small percentage of the doctors and nurses who were guilty ever saw the inside of a courtroom. I think it would be like 0.01%. Interestingly enough, one of the crimes was the falsification of death certificates. That is a serious crime, and it was considered a serious crime. And some of the doctors who were on trial were on trial for falsifying death certificates.
Because at that time, I didn't know about all the infections he had. He'd also gained like over 4 stone in weight, which was fluid. And they told us it was only inflammation. The funeral directors was the ones that says to me, they says they used to have a thing called like a cremation form 4 or something. If they had an issue with the cause of death, which was on the death certificate, then they would get in touch with us people or whatever, they'd tick a box. And I asked them directly, I says, if you still had the forms, if they still existed today, because they'd done away with them, they stopped doing them, I says, would you have ticked that box to say that you've got a concern with the cause of death of my brother's death certificate? And he says to me, yes.
I was going to ask one more thing. Why do you think they did that to Chris?
I think they're trying to use Chris as an example for a COVID death certificate. I think the second the paramedics left the hospital, it was already set that Chris was going to get a COVID death certificate because he arrived at hospital on a blue call, a category 5, reduced to a 1, and they also, going through the notes, allegedly he was triaged by a nurse. Shall I say the nurse's name? by a nurse called Zoya Awan. And then it says on the notes that he was triaged by a junior doctor. And guess what her name was? Zoya Awan. So apparently they have a nurse and a junior doctor with the same name, working the same shift, who examined Chris, giving Chris, instead of a 9-10 pain score, a 0 pain score. And also incorrectly documenting what he was there for. Incorrectly documenting my nephew's name, Chris, as no one. They documented his name 4 times as no one. Amazing that a member of staff, or 2 members of staff, had the same name, and they renamed my nephew, Chris, with a K, as no one. But one nurse put, won't leave Chris's side. So I feel that they didn't want any witnesses there. So they documented that Chris arrived by himself. And they documented that he was having the COVID bundle starting, set at 9 p.m, and they started giving it to him at 9:20 p.m. in A&E when they didn't know what was wrong with him. And I can see from some of the pathology that I have that they actually knew at 8:51 and 8:52 by the doctor who examined him at 5 to 3 that he had a pulmonary embolus. But they said they didn't know what he had. And I've got the doctor's name because on the printout they folded it but not very well, because the doctor's name is written on another page and you can distinguish who it is. And I think that's very, very important, that they already arranged what they were going to give to Chris.
He was another, I can't say statistic, it's one of my words I can't say, but he was another basically paycheck, because is it the sequin payments that they was getting? They tried their hardest to get their, I think, I can't put a true figure, but I believe it's around the £3,000 mark or something like that in this country that they get per certificate signed off as COVID, as I call it.
Yeah, on the death certificate.
On the death certificate.
Basically, because I was my dad's next to kin, and I was against it all and that, and I kept getting phone calls off the registry office saying, you know, can you register his death?
We need you to come and sign the certificate.
Sorry, I don't consent to that. And they says, well, why? I said, well, first off, he didn't die of COVID. I says, and that's a lie.
Take that off the certificate.
So I won't sign my name to that. I says, put the true cause of death, which is a lethal cocktail of drugs.
An overdose.
A drug overdose. And I might agree to it.
And they haven't.
Well, still to this day, I'll never agree to it.
He's got no death certificate.
We've got no death certificate
3 years
for him
on.
because I won't consent, because they basically just want me to consent to their lies, because they said his true cause of death was COVID, and it wasn't.
Yeah, and she was. They did say on the death certificate that she died of pneumonia, and because of the way this doctor was acting, I thought it was something a bit strange. So I referred it to the coroner, and thankfully they agreed straight away. Because I said the doctor's behaviour was peculiar, and she was sitting up fine one moment, and the next moment, put an end of life. And so the coroner actually said she died of a changed heart rhythm, not pneumonia. That's what he put on the death certificate. That's what the doctor put on the death certificate, pneumonia. She died of a changed heart rhythm. And I said, well, you mean a heart attack? He said, no, she didn't have a heart attack, just a changed heart rhythm.
Caused by the drugs they gave?
I would think so, yeah.
The whole thing was just such a shock. It's like we went from come and collect your dad at the hospital to he's dead in an ICU ward of COVID. It just...
And was COVID on the death certificate?
Yeah, we did try and challenge it, didn't we? COVID was the primary cause.
And underlying
and then
cause
was hypertension and diabetes.
And they actually they gave us the death certificate, which during the COVID times they stopped doing. It would be sent automatically, and even though they asked us to isolate for the 10 days, they demanded that we bring it back. So we had to go back to the hospital and bring it back. They didn't want us to have a copy of the death certificate.
So what are you hoping is going to happen now? Because obviously it's almost 4 years since your dad was killed. So, and you've done a lot in that time. And time goes fast in these situations, obviously. But what are you hoping is going to happen?
Well, there's. I think if you just keep plugging away at these things, eventually a dam breaks. But it's just a drip, drip, drip. I know we're part of a class lawsuit, so that's really all we can hope for. That moves. I'm under no illusion it's going to take a long time, and I don't know.
Our real goal was just to be annoying, was to annoy them, and hopefully, this ain't going away.
What would make you give up?
Nothing. Just keep plugging away. Let's say we're starting the process, and there's other people that are further ahead than us with certain things. There's certainly people that are equally as motivated as we are. Just see where that gets us, really. But like I say, we're under no illusion. It's going to be a long haul, but unfortunately, a lot of the times, the people who should be accountable aren't accountable.
And that's what you're hoping for, that they will be held.
Well, I would hope so.
And that obviously this process stops, this involuntary euthanasia that's going on. That's the goal, isn't it?
Again, like with the assisted dying bill, it's just part of normalising what they're doing. So we just can't let things like that become part of law.
It's made us lose complete faith in the NHS and hospitals. Recently our mum had to go into hospital just before Christmas last year with some type of flu, and it just literally, it's like post-traumatic stress, like the whole time.
You want to do COVID tests and you're like, no, because you're scared that she's going to follow the same protocol.
Yeah.
I mean, do you think there is some kind of depopulation going on, or some kind of culling of the elderly?
I do think so, because the government have been saying that there's too many older people and they, problem paying their pensions, and there's not enough younger people in the world. But I'm thinking, well, actually, whose fault's that? Because you've been running charities for years and years, and you've been asking for money for medical research, and you've been wanting to keep people living longer. And now you've got what you've asked for. Now you're trying to kill them all off because they're all living longer. I mean, doesn't anybody have a brain cell to work that out? I mean, I don't know. So who's it for? Who's all this medical research for, and helping people to live longer? Is it for the rich? Is it for the elite? Is it for certain people, or are they not really trying to help people live longer? Are they just getting lots of money for charities? I don't know.
Yeah, the CEOs of charities are doing very nicely.
Yeah.
Out of it, and cancer research is a great example, isn't it? It's been going for 130 years or something.
And then the people like the people that sort of head up these charities, they're earning enormous salaries, and
I think that's your answer to that one. I suppose you've answered that really. I was going to say, what do you think is the next step for you personally and your family? Are you going to just let it lie, or are you going to, you know?
I just want to expose them, that's all really. I just want to expose them. It'd be good to prosecute them, yeah.
And
But
that's
I just
why
don't
I'm
know.
afraid of mentioning names and stuff, because you said
No.
bring it on, yeah, take me to court, then that's another way of exposing them.
Yeah.
A lot of people have said it's a different grief process because they know that their family's been murdered.
Yeah. See, I would like to do, if, I don't know, it's not legal in this country, but if you had, what is that, lie detector. Yeah. Because, you know, I'm telling the truth, and I'd like to see them tell the truth. You know, see what they, because they know what they did, and they knew what they were doing. So if they couldn't look me in the eye, when someone's looking after someone, and they look at, you know, they can quite comfortably look someone in the eye and say, look, this is what's wrong, we're trying to do this, but she couldn't look me in the eye. And the same with Craig Leaper. You know, he's trying to tell me, like, if COVID clogs the lungs up, it's like cement in the lungs. You know, that's what COVID does. It's the tightening of the lungs. That's what he said. And then he said to me, if I can learn anything from this, he said, get all your family vaccinated. That's what he said. So it was all about the vaccination, because my mum wasn't vaccinated. But it was all about the vaccination, and that's what it was. I'm sure that is why they done it, because she wasn't vaccinated.
Yeah.
These lockdowns, they're dangerous. They're not just protecting, they're enabling abusers to commit crime, domestic abuse, child abuse, elderly abuse. Everything's done behind locked doors. And like I said, the police don't want to know. They say it's a civil matter, when actually it's not. That's just a cop-out.
Dancers, choreographed dancers, and doctors and nurses with masks on, going like this, pretending they're going on boats and doing choreographed dancing. And they're going, what's going on? I thought that they were, you know, and I wonder, well, can I ask you another question as a journalist, Jacqui? How many people have died of COVID-19 who didn't go to hospital?
None, that I know of. No one died at home. They all died in hospitals or care homes. A couple maybe. I mean, this isn't relevant to your story, but my dad was killed at home by paramedics. But I thought if they put COVID-19 on his death certificate, that didn't happen. But they put lies on his death certificate.
Because it seems that only people that went to hospital died of COVID-19. I know lots of people that work for the NHS do great work, but to restore the trust that the public has in the NHS, there does need to be inquests into everyone that was put on ventilators, I would suggest. That's all I can call for. I don't want to be... I'm in too much pain to throw stones and to blame people.
I'm even more determined now to get this stopped. And there's a lot of safeguards being watered down anyway, so it's not safe anyway. I just do not want this assisted dying to be passed at all, because it's dangerous, it's open to abuse, and it will just snowball. It won't just be the elderly, as we're seeing from other countries, Canada and Netherlands, part of the USA, where it's become law. Over the years, it just snowballs into other vulnerable groups, disabilities, people with disabilities of all ages, children, young adults, elderly, even mental health comes into it. You don't even have to be in pain if your quality of life, and if GPs can get involved, if they think if you're suffering, your quality of life is sort of not worth living. If your life isn't worth living because you're suffering mentally with stress or whatever, instead of treating you with the correct medications, if that's what you want, and the correct therapy, they will sooner offer you assisted dying to put you out of your misery, which in my eyes is just saving money, because it is cheaper to offer assisted dying medications than getting treated for either your diagnosis, your mental illness, or your disability. It's actually cheaper to basically kill you off, end-of-life care drugs, and we all know through the pandemic, the COVID pandemic, all about my Delta 1. And that's ongoing as well, isn't it? So I'm just totally against it. I do not want assisted dying for myself or for anybody else. For that matter, I do not want it introduced into the UK.
With these boards to raise awareness of what exactly is going on in the hospital. We've come across a lot of criticism, as I've said. We've got several other boards as well. We've been to several meetings with these as well, haven't we?
Yeah. The key part about this one, why we feel so strong about the justice is coming, is because we know eventually when the rest of the world catches up with us, justice is coming. And those that have done bad things,
it's a constant reminder that it isn't going to go away, that eventually it's going to catch up with them.
We were unable to stop euthanasia becoming law. Kim Leadbeater's campaign was backed to the hilt by parasites in the ruling class and their foundations they finance for social control. This documentary reveals uncomfortable questions about those in power that decide to implement death protocols that would kill thousands of people. Firstly, it raises the question of the first wave of COVID deaths. Given these were happening on a mass scale, could we not ask whether those put through those protocols were the first wave of COVID deaths? Norman Fenton and Professor Martin Neal's book has showed the flawed statistics behind the COVID-19 event. Cy Wilson tracks the excess deaths to the widespread use of midazolam injections, not COVID-19, which was largely absent. This raises deeper questions beyond the tragedies of this documentary. Our science has been shown to be totally corrupt, but how deep is this corruption? Is the entire virology a fraud? Is germ theory itself a fraud dating back to 1890 and the rise of the Rockefeller robber oil barons who would go on to create the pharmaceutical industrial complex? The pharmaceutical industrial complex has profits you could not dream of. Their profits are larger than the energy sector. It's only fair to ask, was the vaccine brought in for COVID? Or was COVID brought in for the protocols and the vaccines? The British state has already signed a historic pandemic treaty handing out national sovereignty over to the World Health Organization, an organisation that seems to have little to do with health but power and control for a transnational bourgeoisie that organises itself through the Bilderberg Group, Trilateral Commission, Club Rome, World Economic Forum and the UN. Why, for instance, as I documented in my article, were so many of the pandemic exercises in the last few decades ran out of the Military Psychological Warfare Centre, Johns Hopkins University? And why is Johns Hopkins asking if we were ready for the next pandemic?